Hey everyone, welcome back to the channel. Today we're diving into a serious topic: stroke. It's a life-threatening medical emergency that occurs when blood flow to the brain is disrupted, either by a blockage or a rupture in a blood vessel. Now, the reason we are talking about this is because time is brain when it comes to stroke. The faster you recognize the symptoms and seek help, the better the chances of minimizing damage and improving outcomes. So, in this video, we are going to equip you with the knowledge to identify the warning signs of a stroke. Remember, this information is for educational purposes only, and it's crucial to consult a healthcare professional for any health concerns. One of the most common signs of a stroke is sudden numbness or weakness, particularly on one side of the body. This can come out of nowhere and can be quite alarming. Imagine this: you're going about your day, maybe at work or enjoying a meal, and all of a sudden, your arm feels weak or your face starts to droop. It's a sudden and unexpected change that can be very frightening. That's a red flag, my friends. This sudden weakness can be a sign that something serious is happening in your brain. This weakness can affect your face, arm, leg, or even just one side of your face. You might notice that one side of your mouth is drooping, or you can't lift your arm as high as you usually can. You might find it difficult to raise both arms evenly, or you might experience a feeling of heaviness in one limb. This can make simple tasks like holding a cup or typing on a keyboard suddenly very challenging. Now, it's important to remember that not all numbness or weakness is a stroke. There are other conditions that can cause similar symptoms. You could have pinched a nerve, slept on your arm wrong, or have other underlying conditions that might cause temporary numbness or weakness. However, these usually resolve on their own and are not as sudden or severe. But when it comes to stroke, it's always better to be safe than sorry. The consequences of ignoring these symptoms can be severe and life-altering. If you or someone around you experiences sudden numbness or weakness, especially if it's accompanied by other symptoms we'll discuss, don't hesitate. Call 911 immediately. Quick action can make a huge difference. Remember, time is of the essence when it comes to stroke. Every minute counts, and the faster you act, the better the chances of a positive outcome. The faster you act, the better the chances of a positive outcome. Emergency responders are trained to handle these situations and can provide the necessary care to improve recovery chances. Once at the hospital, doctors can perform tests to confirm a stroke and start treatment immediately. Early treatment can significantly reduce the risk of long-term disability. Rehabilitation is often a crucial part of recovery, helping stroke survivors regain strength and function. Physical therapists work with patients to improve mobility and independence. With prompt medical attention and proper rehabilitation, many stroke survivors can lead fulfilling lives. So, always be vigilant and act fast if you notice sudden numbness or weakness. Let's talk about another crucial warning sign: confusion or trouble speaking. Imagine trying to communicate, but the words just won't come out right, or you're having difficulty understanding what someone is saying. This can be a terrifying experience, both for the person experiencing it and those around them. Stroke can affect the areas of the brain responsible for language and communication. This can lead to slurred speech, difficulty finding the right words, aphasia, or complete inability to speak. You might also notice that the person is confused, disoriented, or having trouble understanding simple instructions. They might seem like they're in a daze or not their usual selves. Again, these symptoms can be caused by other conditions, but if they come on suddenly, especially with other stroke symptoms, it's crucial to seek immediate medical attention. Now, let's talk about vision problems, another potential warning sign of a stroke. Vision issues can be one of the most alarming and immediate indicators that something is wrong. Imagine this: you're going about your day, and suddenly your vision becomes blurry or you experience double vision. It can be disorienting and frightening, especially if it happens out of the blue. It's like someone just hit the distort button on your eyesight. Everything you see becomes unclear, making it difficult to perform even the simplest tasks. Stroke can affect the areas of the brain responsible for processing visual information. These areas are crucial for interpreting what we see and making sense of our surroundings. This can lead to a range of vision problems, including sudden blurred vision in one or both eyes, double vision, and even more severe issues. Loss of vision in one or both eyes can occur, making it impossible to see clearly. This can be particularly dangerous if you're driving or operating machinery. And partial vision loss, like seeing only half of your visual field, can make it difficult to navigate your environment safely. These vision changes can be temporary or permanent, depending on the severity of the stroke and how quickly treatment is received. Immediate medical attention can sometimes reverse the damage. If you experience any sudden changes in your vision, especially in combination with other symptoms we've discussed, don't wait. Seek medical help immediately. Early intervention can be crucial in preventing long-term damage and improving recovery outcomes. Let's move on to another symptom that should never be ignored: difficulty walking. Imagine this: you're walking, and suddenly you feel unsteady, dizzy, or like you're about to lose your balance. It's like the ground beneath you is shifting. Stroke can affect the areas of the brain responsible for coordination and balance. This can lead to sudden dizziness, loss of balance, difficulty walking, lack of coordination, and feeling unsteady on your feet. You might notice that the person is stumbling, staggering, or leaning to one side. They might even fall without any warning. These symptoms can be incredibly disorienting and frightening, so it's crucial to seek immediate medical attention if you or someone around you experiences them. Last but not least, let's talk about severe headaches. These are not just any headaches. They can be a sign of something much more serious. Now, I know headaches are common, and most of the time, they're nothing to worry about. We all get them from time to time, whether it's from stress, dehydration, or lack of sleep. But when it comes to stroke, a sudden severe headache that comes on without warning can be a red flag. This type of headache is different from your usual tension or migraine headache. This isn't your typical tension headache. It's not something that gradually builds up over time. This is a headache that hits you like a bolt of lightning, often described as the worst headache of my life. Imagine a pain so intense and sudden that it feels like your head is going to explode. The pain can be so intense that it can wake you up from sleep or make it difficult to think straight. You might find yourself unable to focus on anything else because the pain is so overwhelming. It might be accompanied by nausea, vomiting, or sensitivity to light and sound. These additional symptoms can make the experience even more unbearable. If you experience a sudden severe headache that's different from any headache you've had before, especially if it's accompanied by other stroke symptoms, don't ignore it. Seek medical attention immediately. Early intervention can make a significant difference in the outcome. So there you have it, the key warning signs of a stroke. Remember the acronym FAST: facial drooping, arm weakness, speech difficulties, and time to call 911. Stroke is a serious condition, but early detection and treatment can make a world of difference. By knowing the signs and acting quickly, you can help save a life, maybe even your own. Share this video with your loved ones, spread awareness, and let's work together to combat this silent threat. Remember, knowledge is power, and in this case, it could be life-saving. Stay informed, stay safe, and take care of yourselves and each other.